the study I was mentioning was in healthy individuals, but different study, which was published in the journal Immunotoxicology and Immunopharmacology, was done semi-blind. What do I mean by that? The doctor selected his patients who had chronic fatigue and fibromyalgia. I didn't know about it. So what he did, he drew blood, sent it to our laboratory, and then he gave them 60 milligram per kilogram body weight, another meaning around 3 to 5 grams powdered vitamin C, put in a glass of water, they dissolved it and drank it, and told them come back 24 hours later. And then drew another set of blood, they sent it to our laboratory. We did just, the only thing we knew that the doctor is asking for looking at T cell function, B cell function, lymphocyte subpopulation, and natural killer cell. Another meaning, the doctor wanted to count the soldiers of the body from one hand, from other hand to see if the soldiers of the body have enough ammunition to fight the infection and viruses and so forth. So when we did that, we were blinded. After 1 year, he did close to 100 cases. And then he came to my laboratory and he said, well, let's go ahead and break the code and compare the results side by side. When we put the results side by side, meaning blood before the use of vitamin C and 24 hours after use of 3 to 5 grams of vitamin C, were unbelievable. In about 70% of the cases, we found the number of the soldiers in the body did not change, but the functional capacity, how to fight the enemy, the viruses and the bacteria, changed very significantly. And we call that T cell function and B cell function. Another test was natural killer cell activity. This is a cell knows how to fight cancer cells in our system. And that cell in particular, NK cell or natural killer cell activity, was significantly elevated in 70% of the cases, almost to tenfold, by just taking 3 to 5 grams of soluble vitamin C orally. So that was the best conclusion, that 3 to 5 grams of vitamin C in individuals who have low natural killer cell activity, low T cell function, low B cell function, can enhance their immune function and protect them against viral infection and cancer in the future. These patients were patients selected for having chronic fatigue and fibromyalgia. Remember, these patients to begin with have very low natural killer cell activity, low T cell function, and low B cell function. By giving them vitamin C 3 to 5 grams a day, completely the immune system changed towards having fighting capacity against viruses and cancer cells. So therefore, in this case, 3 to 5 grams was very, very beneficial to patients with chronic fatigue and fibromyalgia.
And how long did this study last? Was it just one time over 24 hours?
Over 24 hours, and some he continued for a month, and NK cell and T cell and B cell function was sustained, and therefore the conclusion of that was, if you want to keep your immune system strong, you better use every day some levels of vitamin C.